Today, I'm very happy to be up here and to be addressing this particular group because I want to talk about some great challenges that we all have. Great challenges in health and medicine specifically, but for us, in the federal space, I think we've been involved in a lot of challenges lately. A lot of people have heard about developer challenges, what we can do with the data when we put it out there, what can private people, developers, companies do with our data, innovative things. It's been a piecemeal approach to some degree. But what are some of the great challenges before us today where it's difficult to even wrap our heads around? But we know they're there. These are great challenges of health and medicine that we all feel, but we can't seem to verbalize sometimes and can't even begin to tackle in a collaborative, coordinated way. So what is a great challenge? Over a century ago, we struggled as a civilization to build so that we can live in clean cities. It was not a transformation that took place overnight. It took decades and decades of multidisciplinary people, groups, trade groups, people, just geniuses thinking about, well, how do plumbing fixtures come together? How does a basic infrastructure get into place? Well, if we take that scale of a problem and apply it to the work we do today, health and medicine, let's take this as an example, childhood obesity. We know it's a problem. We know it's a huge problem, that it's going to be a bigger problem as we go down the line. This is a great challenge. But there is no single one solution that any one person or one organization can truly tackle in an effective way. We know it's going to take all of us working together. Certainly kudos to the First Lady for taking on this challenge and making it a national issue. But we have to make it even more. Because a great challenge like that also spurs other great challenges that we have. So whether it's about our diet, whether we exercise or not, and how we actually get people to move. We know it's good for you. We know it's good for us. All of us know it, even the ones who don't exercise. And of course, food and technology, how that's going to affect us. These are great challenges. Others that we can think of, if you expand it out globally, we as a human civilization, how can we tackle things like this? Whether it's stress, not the immediate effects that we see on a person, whether they're lonely and isolated or stressed out, but the social problems that we know it causes, the health problems that we know it causes. Other challenges that exist in terms of great challenges of health and medicine. We know about these things, the role of the patient, its evolving role. How do we get people to actually comply with prescription medications? We know that this is a big problem. Huge percentages of people just don't even take their medicines when they're prescribed. And what are we truly asking our patients to do from an informed consent model? To make complex decisions about their health care. Patients are becoming more and more consumers. So we know that. And we're trying to treat them like that. The health industry is. And should we be? And is it all good? We know for a fact there's a great challenge in Alzheimer's. It's coming. And the caregiver crisis is going to be even greater than ever. So with all of these great challenges coming, and they're here already, we've all known about them, we've talked about them, and we kind of tackle them piecemeal. We say, well, hospitals should change it, well, government should do something, industry can change this. Well, maybe. But we have to work together. We all know that. That's common sense. These are problems too big for a single person, organization to tackle. These are obvious great challenges. But how do we tackle it? Well, for us, I think one of the big things that we can all kind of gather around is the topic of medical communication. Why is it so hard? We've been talking about it since yesterday, from pre-conferences all morning. These great challenges. How do we convince people to change behavior? This is a great challenge that we have and that we all share in this room. Well, why am I up here today talking about these great challenges? Well, I'm pleased to announce that TEDMed and the National Cancer Institute that we've partnered, that NCI has agreed to be a clearinghouse for cancer-related great challenges, that TEDMed, in co-sponsorship with Robert Wood Johnson Foundation, they want to bring these great challenges to light, not necessarily to talk about the solutions, because there is no single solution, but to baseline a common understanding based on science, on the facts. What is the evidence? Whether it's talking about childhood obesity or the role of the patient or health communications, we know in this room a lot about health communications and medical communications, but how can we all work together, come up with a plan? So we've partnered to support TEDMed in their endeavor to highlight some of these great challenges of health and medicine. Now, in 2012, in April, the first TEDMed is going to be happening in the Kennedy Center, Washington, D.C. this year. At that time, a good number, maybe some of these, will be featured at TEDMed conference. And there will be inviting, certainly in TEDMed style, the world's leading experts, credible, highly credible people that we can put up and talk about these great challenges. These are socio-political, highly charged topics. So who do we get up there to talk about these things? And this is a challenge that we have too, to try to identify, to help TEDMed and the Robert Wood Johnson Foundation figure out who are the right people to send up for these 15, 20-minute talks to illuminate the world on these great challenges so that we, as a society, as a civilization, can begin having a common discourse based on common facts, based on common evidence. So, with medical communication and health communication in general, and the challenges associated with that, and the sub-challenges behind that great challenge, we are here today, the NCI is here today, to engage everyone in this room. We want to hear from you. What are your ideas about some challenges that haven't been considered yet? What are other great challenges when it comes to health and medicine, but more specifically for us, as digital health professionals, practitioners, technologists, passionate people in public health? How can we inform this discussion at a national level so that maybe we can change the national discourse and policy and socio-political understanding about these great issues? So I haven't posted any cancer-related great challenges up here because Dr. Lenora Johnson, Director of Communications at NCI, will be coming up later this afternoon to highlight a great challenge that NCI deals with. Now, in the meantime, to kind of get people's feedback and engagement, we've set up nothing gorgeous, but thank you, Jay, for setting up a little idea scale page for us. We've put up just a couple things up there so you can learn about what great challenges are, what the TEDMed program is all about, and we'll be posting a lot more content up there about, well, here's some great challenges in health and medicine. Here's one about a topic that's very near and dear to us, and so on. So we're going to start putting it up there, and we want you to engage us. We want your ideas. We want and we could also do this types of ideas. This is the first time at this meeting where we're pleased to announce this collaboration with TEDMed, and so it was very important to us, as it seemed like a perfect opportunity to engage the people who are sharing in the similar challenges that we have here at the NCI. As health communicators, when it comes to cancer, we struggle with all the challenges that have been highlighted this morning. We try to go through all these best practices and everything else, but it's still very, very difficult. And that's why we're here today, to ask for your help. So with that, we're going to leave that up, and you'll hear Dr. Johnson talk a little bit more about, from our perspective, what a great challenge may be around cancer. And we hope that you'll go to the site, cdhw.ideascale.com, and start joining the discussion. So thank you.